It's not surprising that healthcare workers on the front lines of the coronavirus pandemic face increased chances of contracting COVID-19. They risk lost wages, expensive healthcare costs, and potential death. What is surprising is that sick workers and families of those who've died from the virus are finding themselves fighting for workers' compensation. A recent Kaiser Health News report found that in some states, the chances of getting benefits paid are a long shot. I recently spoke with Christina Jewett, senior correspondent with Kaiser Health News. So what is happening to many healthcare workers as they go back to their hospitals and say, hey, I got COVID, I've got all these bills, I've been out of work for weeks. What happens to them?
Employers and the insurance carriers are asking workers to pinpoint how they got COVID at work. So in the case of a doctor or an RN, you might have a really bulky medical record to look through and say, oh, this patient this day, this is what I believe happened. But what we found was was a laundry worker, a maintenance worker, someone changing the air filters in a COVID room. Those workers were getting their claims denied. I mean, it's very hard for a worker in that position to pinpoint a single patient. They're probably not even privy to that knowledge. So those were the cases that we saw popping up where workers were initially seeing denials.
So if they're cleaning the sheets of sick patients and if they're cleaning the air filters from the room full of COVID-19 air, they still have to prove that that's how they got COVID in the first place to get compensation.
Yeah, in most states, the burden's on the worker. The worker has to pinpoint how they got it. But there are a spate of laws that are coming online. Legislatures all over the country are looking at these types of laws. There's 16 laws addressing this. And what they've done is turn the tables and made that presumption that, look, if you're a healthcare worker, some states it's an essential employee, you got it at work. And now the employer would have to prove that you didn't. So then the employer is starting to ask questions about, what your cousin, where your cousin's been, or sort of what happened on the bus you were riding to work. So it's a lot easier for workers in those states, but it's just really a mixed bag around the country.
So is there resistance to that idea? These states that are passing this legislation, is there a reason that the other states haven't joined yet?
The resistance is over cost. This is just an insurance line, just, like any other insurance cost to a business. And, the thought is that if they have to pay out these claims, some of them potentially lifetime benefits to a surviving spouse, or lifetime benefits if a worker has residual long-term problems, that those costs could potentially cripple businesses and prevent them from reopening the way we want to see things happen. So that's sort of the flip side argument to, really covering the workers.
You have been chronicling the lives of so many of these healthcare workers who've died during this pandemic. What surprised you when you were reporting on these stories about the families who were trying to get compensation?
We worked on this story in close proximity, and the sister of a nurse who recently died, she talked about the last days that her sister lived. And one of the things she spent time doing was proving that she got COVID at work for her own workers' compensation claim, that she was expecting to backfill some lost wages. And that was something she spent the last days of her life doing, where her employer certainly had those records where they could have seen she cared for a patient who, at the time she cared for him, wasn't known that person had COVID, but later it became apparent that was a COVID patient. So that was a little bit saddening, just to know that that's a person who bravely, went to work caring for incredibly sick patients and had that as sort of some of the last hours of their waking life.
Christina Jewett of Kaiser Health News, thanks so much.
Thank you, Hari.